You know that feeling? You're sick. You've got the cough, the sore throat, you just feel awful, and all you want is something to make it go away. And fast. For so many of us, that one word pops into our heads: antibiotics. But are they always the right answer? Well, let's dive into the official guidelines and find out when you really need them and, maybe more importantly, when you don't.
So this is the big question, right? You're sitting in the doctor's office, you've laid out all your miserable symptoms, and you're kind of hoping for that prescription slip. But should you be? Let's take a look at what the official guidance from organizations like the National Institute for Health and Care Excellence, or NICE, actually has to say about it.
And this might actually come as a surprise. For most of those common bugs going around, the first-line recommendation isn't a prescription at all. It's what they call a wait-and-see approach, or sometimes even a flat-out no antibiotic strategy. Basically, the whole idea is that a lot of these illnesses will clear up on their own. Your immune system is designed to handle it.
And look at this list. It's pretty much all the usual suspects, isn't it? That annoying common cold, a hacking cough or bronchitis, a really painful sore throat, even most ear infections and sinus infections. For all of these, the guidelines are super clear. Hold off on the antibiotics. And a big reason why is that these are usually caused by viruses, and antibiotics, you guessed it, do absolutely nothing against viruses.
Okay, so if the default setting is wait and see, when do we flip the switch? This is the crucial part. The guidelines are really specific about the exceptions, the times when getting an antibiotic right away is absolutely the right call.
So for starters, the exceptions zero in on some very specific cases. When it comes to the little ones, if a child under 2 has an infection in both ears, that's a big red flag. Same goes for any child who has fluid actually draining from their ear. And for sore throats, it's not just about how much it hurts, it's about checking off a very specific list of symptoms that strongly suggest it's bacterial.
And that checklist, it has a name, the center criteria. Think of it as a simple but really effective tool doctors use on the spot to play the odds. It helps them figure out the chances that your sore throat is caused by Streptococcus bacteria, strep throat. It's all about making a smart, evidence-based call instead of just guessing.
So, what's a doctor looking for? It boils down to these 4 things. 1. Can they see white spots on your tonsils? 2. Are the lymph nodes in the front of your neck swollen and sore to the touch? 3. Have you had a fever? And 4, and this one's a bit of a curveball, is there an absence of a cough? See, a cough usually points toward a virus, not bacteria.
And here's the magic number, 3. If you take off 3 or more of those 4 boxes, the odds of your sore throat being bacterial strep shoot up to between 40 and 60%. And with odds like that, giving you an antibiotic becomes a totally reasonable thing to do. It's not a shot in the dark, it's a calculated decision.
All right, let's shift gears to another major reason for an immediate prescription. Sometimes the decision isn't just about the bug you've caught, it's about you. For patients who are considered high risk, the whole playbook changes.
So, this is when a doctor is definitely going to reach for that prescription pad. If a patient is just systemically or all over very sick, or if there are signs of something more serious brewing, like pneumonia. Also, if you have pre-existing conditions, we're talking serious heart, lung, or liver disease, or if your immune system is compromised, your body just doesn't have the same reserves to fight. So you need those antibiotics to get a head start.
And this slide is a perfect example of just how specific these guidelines get, especially for older adults with a bad cough. Just look at the difference here. If you're over 65, you need to have 2 or more of these risk factors for an immediate antibiotic. But once you're over 80, the bar is lower. Just one of these things, like having diabetes or being in the hospital in the last year, is enough to get that prescription.
Okay, so your doctor says you don't need an antibiotic. Now what? Well, the next step is all about managing expectations. A huge part of feeling in control when you're sick is just knowing how long this thing is supposed to last. It really helps you figure out when to be patient and when to start getting a little concerned.
Seriously, this table is so helpful. Just look at these timelines. An ear infection often clears up in just 4 days. A sore throat is usually done in about a week. But that cough or bronchitis, that thing can stick around for 3 full weeks. 3 weeks. Just knowing that can save you so much stress. If you're still coughing your lungs out after 2 weeks, it doesn't automatically mean something is terribly wrong. It can just be the illness running its normal, frustrating course.
And that's the real power here. This isn't about just toughing it out. It's about being informed. When you know the typical recovery time, it completely changes how you think about being sick.
It means you and your doctor can make better calls together because you have a baseline for what's normal and what might be a sign that things are taking a turn.
So at the end of the day, the goal isn't to just walk out of the clinic with a prescription in hand. The real goal is to walk out with the right care plan. And yeah, sometimes that plan includes antibiotics. But a lot of the time, it's about understanding the illness, managing symptoms, and giving your body the time it needs. It's really about shifting the question from what medicine can I get for this to what's the absolute best way for me to get better.
And that's our look at this super important topic. All the material you saw today was prepared by Dr. Mohammed Al-Naghi Mohammed based on the official NICE clinical guidelines. Thanks so much for tuning in.